All right, so now we're going into renal system. So like I said, every time you hear renal, think kidneys, all right? Filtration. The kidneys filter the blood, take all the waste out, and put the good blood back into your system. So as far as the entire renal system, it has three components. You have your kidneys, your ureters, and your urethra. Responsible for filtering blood and removing waste. Like I said, maintains fluid balance and maintains acid and base balance. And it does that all through filtration, obviously. It's gonna filter out the bad stuff or the stuff that you don't need, and it's gonna put all the good stuff back into your system. Affect many different portions, range from minor to life-threatening. So yeah, so renal failure is pretty common, especially in the elderly population, and it goes from minor to mild to, I guess, severe, which severe would be it's called end renal stage failure or something along those lines. But it'll come up in a slide here in a second. Yeah, so it'll loop back to it towards the end of the chapter. So as far as the UTI, it's just usually it's a bacteria infection limited to the bladder. Now it can spread. So if you leave a UTI unattended, if a patient does, and the bacteria continues to spread, it could eventually pass the bladder and get into your kidneys. So if this actually reaches your kidneys, it's called pyelonephritis, all right? So all that really means is it's an inflammation of your kidneys, and it's from a UTI that wasn't treated on time. And I actually also have a video on this. So I'm gonna